Hey ladies, it's Professor Wagner here, about to dissect a fetal pig for your viewing enjoyment. I'm gonna just show you like the quick, easy way to open the pig up, and then in the first clip, and then we're gonna have subsequent clips going over the specific anatomy that I want you to know for your upcoming quiz. So, first thing we're gonna do is we're gonna need a scalpel. And you wanna make an incision starting at the lower abdomen through the body wall. I'll go nice and slow and easy because you don't want to damage any of the underlying tissue. I'm going to make it up toward the umbilical cord, which we can actually see the umbilical cord right here. It's just a nice, easy incision, like so, through the body wall. We're going to want to go around the umbilical cord, like so, because there's some important blood vessels that you're going to want to be able to view and be aware of. And then once we're up past there, I want to go up toward the rib cage. Yeah. Once we got most of that stuff kind of out of the way a little bit, we can start using the scissors. Now you want to use the scissors because, there you go, thanks. Thank you, Liam. So I want to use the scissors because the rib cage can be kind of hard to work your way through. Now the way I do it is, you know, see it has a blunt end and a sharp end. You want to kind of set the blunt end inside of the pig, and that way you're not going to tear up any of the internal organs as you cut, for the most part. So you want to snip right up through the rib cage, like so. Now once you've done that, you want to kind of make some lateral incisions. I'll make the first one kind of along the rib cage, like this, just to kind of open the pig up so you can see the internal organs a bit better. Right down through the back of the body wall. See, there's quite a bit of fluid inside. That's essentially from the preservation process.
It is blue on it.
Yeah. Liam just noticed some blue. What we're actually seeing with the blue is these pigs are injected. So they inject blue latex into the veins and then red latex into the arteries, so you can tell the arteries and veins apart a little bit better. So I'm going to do the same thing on the other side. I'm going to cut around the umbilical cord, once again, trying not to destroy any of the umbilical arteries or the umbilical vein. So those are a couple things you're going to be responsible for on your quiz. You can see there. And then we're going to go down the other side as well.
Hey, are we going to eat it?
No, Liam, we can't eat it. This has got chemicals in it to preserve it, so it doesn't rot.
Does it still have the heart inside?
Yep, it still has the heart inside. We're going to look at the heart, buddy. Good questions. So that's my son Liam. He is 5. So he's here observing as well as my other children. So if you hear questions pop up, don't be surprised.
Dave, I used to be 4.
Yes, you did used to be 4, but now you're a 5. You're a big boy now. All right, quiet, buddy. All right. So now we're going to take our scalpel up toward the neck and try to view some of the structures in the upper part of the chest and neck of our friendly little piggy here.
I can see its ears.
Yeah. Now, if you're actually going to cardiothoracic surgery, you're going to be using a chest spreader for this, but for our purposes, since we don't have a chest spreader, we're going to have to use our hands. You're going to hear some ribs crack, unfortunately. So, it might be a little bit disturbing to you, but it's the only way we can really open up the chest cavity to see. I cut through the diaphragm as well a little bit so we don't rip it as we do this. So I'm actually cutting through right now as part of the pleura, part of the diaphragm, and a little bit of the pericardium as well, which you should all know from some of our earlier studies. And then what we have to do is essentially just spread the ribs like so. And notice the pleura is holding on pretty well, as well as the thoracic. There we go. Nice and open like that, so we can see all the organs. Very good. Very nice. All right. So once we have everything opened up and pinned down, we can start looking at the specific anatomy. So we will just pin this stuff down like so, best we can. And then we're going to pause the video and start looking at some of the actual internal anatomy that we want to look at. All right, here we go.